So unfortunately, like a lot of the times, once women hit 30, anxiety starts and depression starts. Life gets real. We get into adulthood where we have to pay the bills and we have to keep the family. We have to do the
Raising
laundry,
humans,
all the things. So they go to the doctor and the doctor's like, oh, you're depressed.
Mhm.
That's what it is. Wait, you don't have sex drive. You're gaining weight. What do? We put an antidepressant in to make you have more weight gain and more loss of libido. You know what I mean? And so, but really where that correlates is we start to lose our progesterone. Progesterone is a childbearing age hormone. And if you think back about the history, when were we having kids back in the day? Young. 16, 17, 18, younger, And so and a lot of our environment's changing and our internal time clocks are changing where we start to lose that childbearing hormone really soon.
Yeah.
And so really, progesterone, you can put that back in and all of a sudden, we're not estrogen dominant. Mm-hmm. We don't feel crazy. We can sleep. We're not having the hot flashes. Our anxiety's down, So, but most people don't realize that like high cortisol and high stress really kills off your natural hormones. Mm-hmm. And so if they've especially been through something traumatic, if they've been even competitive sports their whole life, that can really wear on your body. So if you look at it, that's when they're started on antidepressants is they're like, oh, I don't have the motivation that I used to. Yeah. Oh, I'm not sleeping good or I'm sleeping too much. I must be depressed. And it's like, so that's one of the biggest things that people need to realize, like, yes, time and a place for modern medicine. Absolutely. Like you said, like I am not telling anybody to stop their antidepressants or anti-anxiety medications, but just have somebody dig a little deeper.
All right, guys, welcome back to the Law of Cassidy. I'm super excited for episode 3 with the mega expert, my bestie in the whole wide world, Miss Haileigh Mason. She is a nurse practitioner and a founder of Mason Wellness and Mason Aesthetics and Wellness. I mixed them up, sorry. Over a decade of experience in hormone therapy, and she's one of those rare providers who actually listens to what's going on with your body and listens to everything you say and educates well, which I think this world is missing. So welcome to the Law of Cassidy.
Thanks for having me.
Yeah.
I appreciate it. We've been waiting a long time for this. We've been talking about this for years.
A long time, I know. And I kind of just want to get into who is Haileigh, why you landed in this world, because it's kind of, I like to kind of relate it to what I do because I chose a path that's a little taboo, a little like against the grain. Mm-hmm. You know what I mean? Yeah. So we're going to get this out of the way in the beginning, and then we're going to do some fire questions, like fun questions, and then we're going to get deep into the nitty-gritty educational stuff because I know that's where you like to nerd.
Yep.
Okay. But before we get into it, I love to honor a part of, I'm start crying. Haileigh.
Don't cry.
I know. Haileigh, that some people know, a lot of people don't, I really wanted her on here because we all have shit, and we all go through things, and the person she has become because of her past and her history is actually remarkable. So I want to bring up the man, the myth, the legend, and then we'll talk about Matt also. But I want to bring up Tyson. So tell me who Tyson is.
Yeah, so Tyson Lee Mason is my late husband. He is my one little boy's father. We were married and we had my son Lucas, and about a week later, he passed away in a car accident. Tyson did. That was the moment that my whole world shook and changed. Life as you know it is just everything's perfect, and then the next minute it's just gone. Everything's different. I mean, you have no security blanket. You don't know if you're coming or going, anything like that. Tyson always wanted me. Well, he wanted to be a stay-at-home dad, to tell you the truth. He wanted to stay at home. He worked for Life Flight. He was macho paramedic, firefighter, all the things. So he's always like, hey, you should go to MP school. I'll stay home and take care of the kids,
Will you be my sugar mama?
Yeah, he's like, I want to work Life Flight part-time and call it good. So after he passed, I was like, what could I do to help people? Because that's literally what he did. He died on the job, He was coming back from a shift, and I just wanted to continue his legacy. So what I did is I actually threw myself into nurse practitioner school like 6 months after the accident. I actually decided on acute care nurse practitioner because I wanted to be like Ty. I wanted to do all the cool stuff that he was doing, right? And so shortly after I graduated, I realized that there was a huge need for preventative medicine, not just waiting until, people are so sick that they come to you in the emergency room and then you try to fix them short term and then you never hear from them again. Right. And so I therefore left the hospital and started practicing hormone replacement therapy because it is very preventative. So the clinic is named after my late husband. It's called Mason Aesthetics and Wellness. I'm trying to drop the aesthetics out, even though we're bringing on tons of new aesthetics. But
it's aesthetically pleasing.
It
just
is
leave
aesthetically
it. It's fine.
pleasing.
I just don't know how to say the
word.
word.
It's really hard to spell too. Like, ask me how many times I've messed up on forums.
ChatGPT, how do you spell
aesthetics?
Yes.
Or it was like aesthetics. But anyway, so the clinic's actually named after him for Tyson Mason Wellness. And
so I know we've had the conversation before, and it's something that I've just been so impressed by you is in these dynamics, everyone's situation is different, right? But like you were kind of put in a situation that was, you were going to be okay, right?
Yeah.
You're not okay, but you were going to be okay.
Yeah.
And I remember you telling me, like, I'm going to cry. I had a choice to make in life, and it was either sit in my bed and stare at a wall.
Yep.
Or get up and do something.
Right.
And you had a brand new baby, which I've been through postpartum. A lot of people have been through postpartum. We're going to talk about it with hormones and stuff. Like the fact that you have this brand new son, you just lost your person, and just deciding like, no, I'm going to do this. Like, what were you telling yourself in your head every day? Like, how were you getting through? And who were these people that were, because you and I weren't close yet. We'll get to how we met, but you had an army of people, and they show, I love it. We were just at a gala at an event, and it's like these bros just come up to you and they just love on you and they just take care of you. So I just kind of want to dig into that little piece, and then
So being part of the fire community, and I've learned as well with the police community now, because my husband now is a policeman. But being part of that fire community, that was probably the best thing that could have happened to us, because yes, I had lost my person, but I had gained 400 husbands overnight.
Oh, and
I mean, and all of these wives and sisters and just all these people. I mean, there were Saturdays that I would wake up and a crew would be in my kitchen. They'd be in my kitchen making coffee and breakfast. They'd like crack my door open and be like, "Can I come get Luke yet? Is he awake?" Like all of these guys that were just like stepped up to the plate. I mean, still to this day, I just had one of Tyson's best friends show up on Christmas Eve at my house just to come and hang out for a minute, So they made me feel like I wasn't by myself. They made me feel like I was untouchable. Like, cause people, like, I'm sure, you get this all the time. That's hence why I can't read your comments and shit on social media, but people capitalize on horrific things and little tiny mistakes or anything else that people happen to know about in your life, And so like immediately I had my locks changed on the house. Like I was just brand new widow. People knew that like life insurance and all these things were happening. Just things that you don't think about. Like they're like, no, you need to change your gate comm and you need to change this. I had people like scavenging the accident site looking for keys and looking for all sorts of like just things. So I didn't have to think about it, you know. And my late husband's family was so involved and so awesome too, just very hands-on. Like, anything I needed, they were there. My family, my mom stayed with me she lived with me basically for the first year. My little sister Sienna, like she was there with me, waking up every 3 hours with Luke, So at that time, I'm just like, okay, it was almost so good for me though too, because I was like, okay, I've got to show people that I'm gonna be okay, right? Because like I remember my dad saying, we got to watch her really close because she just had this baby and the hormones. Well, I already had hormone replacement in the bag, right? Like I worked for this amazing guy that was like, hey, make sure you're taking your progesterone, to help you with postpartum and those types of things. And I just was like, okay, I'm going to prove to the world that I can do this. This is absolutely awful, but I'm strong enough to get through this. but it wasn't without help. I did
Yeah.
have my days where I didn't want to get out of bed and I didn't want to, but I made a promise to Tyson that I was going to give Luke the best life and we were going to survive this, know, because he would have done the same thing for me. He would have carried on. He would have busted his ass to make sure that we had everything we needed. So I did it. I made a promise to him that night that before his funeral, I stayed with him in the mortuary and I just said, I'm going to take care of Luke. I got him, because he had us for so long. So anyway, and then just kind of throwing myself into school, it was a way to keep my mind right, if that makes sense.
Totally.
Like it maybe wasn't the best coping mechanism, maybe wasn't the best.
That's a weakness and a strength of mine too, is sometimes I'm a workaholic.
Oh yeah.
Like I'm in my zone when I'm like,
it's
working.
Comfortable and you know it and you can own it and it's in your control, right?
Yeah.
And so, I loved school and that's what was in my control at that time.
Little school nerd.
Oh yeah.
Definitely was not a school girl.
Oh,
That was not for me.
No.
Okay. What does Lucas know about his dad?
Oh, God. All the good things and some of the bad. Sometimes he'll throw me a look or something and I'll be like, dude. Yeah. I'm like, that is so your dad and you're going to piss me off. He's very persistent. He knows Tyson is the hero that he was, and the hero that he is. I mean, the night before he passed away, he did some miraculous things on a call and saved I think 2 or 3 lives, like right before he passed away, and he was so excited to be a dad, but he has a presence with us. I mean,
it's
Matt.
wild.
Matt talks about his dad. Mm-hmm. We have pictures up. We talk about, your dad was really good at that. Like for instance, like hockey, like his dad played hockey. Luke gets a pair of skates on for the first time last week, gets out on the ice. And he's doing twirls and stuff. And I'm like, oh my gosh, I'd be on my butt. But that's from Tyson, So he has to understand that all of this amazing coordination that he has isn't from me. I always say that's from your dad, So we really keep it a positive. It's hard because Luke, I think, tries to hide his feelings sometimes. He doesn't want to feel that sadness and he knows that it kills me when he's so sad. But we make sure we have space to cry together and, I make sure that he can feel all the feels. But we try to make sure that he knows he is and was an absolute hero.
When it comes to grieving, I remember we were talking about, I don't remember who it was. Somebody had lost their husband. I think it was a police officer. And the husband was a police officer and we were talking about the wife and what can be done. And I remember you saying to my mom, because my mom had a connection with that wife, saying, hit me up in a month.
Mm-hmm. Oh, yeah.
Because she's good now.
Oh, yeah. Yep. She's surrounded now. It gets harder about a month to 5 months in.
Yeah.
All of the hoopla around it, all of the social media and all the, all these people at your house and all these things it's so overwhelming at first. And then it goes silent. And that's when life gets really, really hard, So that's why I'm always, anytime, like I actually ran a widows group for about 2 years after Tyson's accident. And there were some that weren't getting out of bed. Like their family members would drag them to our meeting, and things like that. But it's always, as soon as it dies down and it's quiet, that's what gets people. And that's the hardest. So that's when people need to step in. Don't do it right then and there.
Yeah.
They need food, yes, that week, but really they need food brought to them 3 months down the road on a random Wednesday. You might catch them laying in bed and haven't showered for 3 days. Like that's when they need your help.
Yeah. And I kind of wanted to share that just so people could hear and understand, because I think it's hard being someone on the outside being like, what can I do for this person?
Oh yeah.
How can I help them? And you don't understand a loss. I don't know why I'm crying. It's just so cool to me, like what you've done. You don't understand a loss and you don't understand what someone's going through, even if it's not grieving a loss of a death, like just life in general, just how you can show up differently, how you can be a better person in that way is just really important.
Well, and one of the big things is don't tell them that you're sorry. Like, please do not say, hey, I'm sorry. What you look at them and say is you say, this is the most effed up situation I've ever been a part of. And this is freaking stupid. That's what you say. Don't tell them you're sorry. Cause then it makes this weird, like, how am I supposed to say, like, oh, thank you? Or, oh, it's okay. No, it's not okay. Like, don't say you're sorry, So just little things to acknowledge how horrible the situation is in a way that they feel like they're connected with you.
And I think that's things we learn too. I've learned in therapy is like understanding emotional maturity. And in those moments, understanding your feelings, understanding other people's feelings. It's maybe say, hey, if you need a vent and get it out, like I will scream with you.
Right. Oh yeah.
Like let's go to a rage room. Like let's go like, because instead of saying like, oh, I'm sorry, and I think people do that because they don't really have a full understanding on their emotions, on other people's emotions, and they just don't know how to navigate. And I think just sharing like this with people and talking through I think really can, help other people navigate, because it happens all the time. Freak accidents happen all the time. And you're not prepared for it.
It does. I was always wondered if it happened so much before I was so used to it, but then after it happened to me, it's like, oh my gosh, oh my gosh, oh my gosh, oh my gosh. It happens all the time.
Yeah.
And so with people just more aware, just don't say I'm sorry. Take them stuff about a month or two after the accident. Check on them. Then come over and sit on the couch.
Yeah.
That's all they need.
Watch
That's it.
Trash TV
Oh
and
my
eat some ice
gosh.
cream.
Yes, absolutely.
Okay. So I'm going to explain how we met.
Okay.
I don't remember the first initial meeting. You do. So first time you met me was at a party. You were like 18.
Yep.
Okay.
Yep. There was like green plush carpet. I have this vivid
green
memory
carpet.
of you like standing up there doing your thing, and there's this like green plush carpet.
The terrible green
I
carpet.
don't know, dude. This was a long
You
time
got brought
ago.
with a friend. You just showed up. You're a party
showed
crasher.
up, and I was just like, okay, here we go.
How I remember is you were like in the mix of like, I had a big customer base back then. I would do like sales and stuff. You always wanted your coochie.
Oh my gosh.
You always
I
wanted
love
your
that.
shave cream, whatever. And I remember getting a message and you're like, I want you to come and do a party. And I told Josh, I'm like, I don't think I can do this because this was 6 months after you lost Tyson.
Yeah. It was wasn't it?
Halloween,
It was our Halloween party. Yeah.
So it was 9 months, 10 months after you'd lost Tyson.
But it was kind of one of the bigger things that I did at my house after that. So,
and I was like, what do you mean she wants me to come to her house and talk about sex toys? And Josh is like, well, maybe she needs one. I'm like, she probably does.
Probably do.
Like, and I just remember like doing that party and walking into that home, and when you're like, Tyson's always been with us, like there was like a sense of like chill and I'm good, I'm taken care of. Like, and I just remember like helping you through that. And I think that party just meant a lot to me because you saw the importance of community and having your friends and helping other women, even though you were going through such a like difficult time, which I think also has led you into your career path.
Oh, absolutely.
Because you understand the connection of your body and stress and hormones and things happening and what it can do to you, and like navigating with women about that. And so that's kind of how we met. And then we're going to get into, I want to get my fun questions. Hold on, guys. We're digging through my notes. I skipped my page. There it is.
And it was a costume party, by the way. Remember? It was
I remember.
Costume party. Yeah.
I remember I was there forever.
You
it was
were
like
there
never
for a
ending.
long time.
And I remember everybody bought the same sex toy too, the main attraction. Sorry, guys. No one knows you were there. It's fine. This isn't a HIPAA violation. So I'm gonna go over some. I needed these notes because I want to ask you these questions so people can get to know like the fun side of Haileigh, but they're not like, don't worry, I'm not going to spill your everything. Okay. Morning person or night owl?
Do I answer my phone when you call me at 9:30 at night?
No, she's a pumpkin. She goes to bed at 8.
No, I want to be in bed and asleep by 9 p.m. Unfortunately, my husband is a night owl, so we have to find like an in-between, but I like to be morning. I mean, that comes from years and years and years working at the hospital though, right? Like my shifts usually started at 5 a.m. I was up by 3.
No.
I had to have my coffee because nobody will talk to me before my coffee's in. It's not a good experience. So yes,
that is
absolutely
true. And if you
morning
have
person.
the wrong creamer, that's a situation.
It is not good. No, and we're going to talk about creamers.
We're talking about sugar-free shit here in a
No
minute.
sugar-free anything.
Speaking of coffee order go.
Ooh, coffee order. You know what? I have to admit to you, like
you suck at coffee orders.
Huh?
You suck at coffee orders.
I do because I don't ever drink coffee from anywhere else.
Yeah, because you're like a home coffee bottle.
Yes,
your
because
Folgers.
If you get
old.
it from some, yes, Folgers. Everybody always bags on my Folgers. My husband and Adriana freaking always say crap about my Folgers.
We were
I
in
love
Florida
Folgers.
and I was ordering groceries, and one of the girlfriends was like, "You got to get Haileigh her Folgers." I was like, "Folgers? Are we 67?"
Yeah,
we
she
are
liked Folgers.
Folgers. Okay,
so no, I do it at home, and I put coffee mate creamer in it with the real sugar. Because I hate Starbucks and all the other places. They're just full of artificial sweetener. They make me break out.
Your most used emoji.
My most used emoji, it's a laughing, crying face.
That is true.
Because when you don't want to cry, you laugh, right?
I feel like I can answer this for you, but I'm going to let you answer this. What's one thing you're weirdly passionate about?
Artificial sweeteners. No artificial sweeteners. Boxers. I love my boxer doggies. Like, I can tell you anything about boxers. I have one right now and he's a little shit, but that's okay. Hormones, inside and out. Everything in the world has to do with your hormones, though. So that's somebody's got to be passionate about it. Somebody has to. Makeup. I really like makeup, even though
I would say history.
Oh, yeah. Of course. Oh, yeah.
We went to freaking Nashville. She's like, we're going to the Country Music Hall of Fame.
I'm trying not to act like I'm 90.
How about we just go day drink? Like, I mean, that's a thing. Like, let's go boot scooting.
I like history. I think it's fun. I am your 90-year-old friend in a 36-year-old body.
But I did enjoy it.
It was fun.
It was. I mean, they had a whole thing on Luke Combs. It was actually really cool. Yeah. I even teared up a little bit. I'm a crybaby, but hormones are fine, guys. They're good.
They're good.
Promise. Okay. If you weren't in wellness, what would you be doing?
Cardiac surgery. Yeah. So again, I'm an acute care nurse practitioner. My background's mostly in cardiology. I did a lot of internal medicine and cardiology, and cardiac surgery. I worked with some of the most amazing surgeons that taught me some of the coolest stuff. I mean, 2% of the whole world gets to hold a human heart. You know, like that is.
And you're one of those people.
Phenomenal. I have touched a human heart. Mm-hmm.
That's pretty intense.
Yeah. Oh, it's intense, especially. Yep.
Yeah.
But it's pretty fun. So that's what I would be doing if I wasn't in the wellness world.
Okay. Last show you binged and loved, was it with me?
Okay, so my husband would tell you that it's actually Young Sheldon. I love Young Sheldon.
Never heard of it.
He's this autistic little boy that is extremely brilliant and very like dry humor, and I think he's hilarious. And it's my comfort show. Matt
says
on
it's
Netflix?
My comfort.
Yes, it's on Netflix.
Okay.
And then Love Is Blind. My garbage. Matt calls it my
garbage. I only watch it with you.
I know.
I can't watch it alone. It doesn't have the same vibe. But when I'm with you, I feel like we're like invested.
What did we watch for a week while we were in Florida last year?
That one.
Was it Love Is Blind?
Yeah.
I thought it was not the beach one.
I don't know.
Anyway,
we love our garbage
we just
TV.
watched garbage.
What's always in your purse or bag? Non-negotiable.
Non-negotiable chapstick. I love the blue OG chapstick. Like the blue label.
Smells funny?
No, it doesn't smell. It smells clean.
It's got chapstick smell.
Yeah, but at least it's really good.
Okay, all right.
Let's see.
What was I love natural ice chapstick. Do you remember natural ice chapstick?
Ew, yeah, but that stuff like cuts your lips up. It literally has like little pieces of particles in it.
Who told you that?
Are you asking me that? Maybe I delve into it myself. Maybe I put it underneath the microscope and looked at it myself.
You probably would.
Yeah, I would.
Okay.
I would.
Text, voice note, or call?
Text. Because voice note, for some reason, I guess I talk too quickly and it never picks it up. So I always text.
I always annoy you and call you. Sorry.
I know. You're a caller.
I'm
it's
a caller.
Okay. So my
dream vacation, mountains, beach, or spa day?
Beach, for sure. Actually, we did go to the mountains this last year, though, for my honeymoon, and that was phenomenal. And to Telluride, Colorado. Oh, my God, it's beautiful.
We got to talk about Matt. We'll do it when I get through these questions.
Yeah.
Pet peeve as a provider.
Pet peeve as a provider. Ooh, which one? Okay, so as a healthcare provider, you're coming to me for help. Please don't tell me you know better. if you're seeking me out,
like you got one-uppers that come in there.
Oh yeah, they'll come in and they'll say, "Well, no, that's not right," or "No, that's not that medication," or like people that are non-medical telling me medical stuff. Woo, that stuff. 14 years of schooling is like a thing. So when people just blatantly disregard that, yeah, people will be like, "Well, make sure you do." If with Luke or something, they'll be like, "Well, make sure you do this, this, and this." I'm like,
hello?
Got it.
I'm in the 2%. I have healthy human heart. You do roofing for a business. Mm-hmm. Like, what do you know? Okay. Yep. And if you could change one thing about how people think about hormones, what would it be?
Oh my gosh, stop being afraid of them. This is literally the fountain of youth. Stop being afraid of hormones. But that's not their fault. It's not their fault that they're afraid. It's a poorly designed study that came out in the early 2000s that scared everybody about hormone replacement therapy. They were comparing, pregnant mare horse urine with natural estrogen. A horse. Okay. Pregnant mare horse urine to natural estrogen that's produced in our body. So unfortunately, there was this big hoopla. Everybody got, afraid of hormones. The use of hormones went from 95% down to 2% overnight. Ooh. Overnight because of this study. So yes, the one thing I want to get across is hormone. If you practice them correctly and you go to somebody that knows what they're doing, they're absolutely like a game changer. They are the fountain of youth.
So Haileigh worked elsewhere and I met Haileigh another time. I feel like we've met like 14 times in our lives, but they're all different. And we just didn't really connect until the last few years. I used to do the fitness competitions, which
Yeah.
I don't know. The world will hate me for saying this. Like, y'all think it's healthy. It ain't healthy.
No,
Like, it is not.
I think anybody that's in that world knows how truly unhealthy it is.
Eating chicken and broccoli for 8 weeks straight and doing 2.5 hours of cardio, like, eventually is going to catch up. So I think my first experience with hormones was a negative one, but I think it's because I was so messed up that I didn't give myself the time to level out.
Yeah.
And so then it was like, oh, this isn't working.
Yeah.
No, my freaking body was fucked up for like 4 years.
Oh, yeah.
And I think that's why it took us so long to get pregnant with Jovi too, because it's just like nothing was functioning properly.
No.
So this is just such a wide, like, things we can talk about. So I'm going to try and like ask questions, but if it leads into whatever. So I think I kind of already asked this, but I'm going to ask it again. When did you know you wanted to build something different than traditional medicine?
Yeah. Yep. So, well, first off, like, let's start with how I got into hormones. So you kind of know, right? So I helped this gentleman start his hormone clinics, got it up and running. That was when you originally, that's the first time you had your hormones checked. And then everything was great. And I was like, okay, stay put. I'm going to go get my RN, then get my MP, and I'll be right back. Right.
Yeah.
Well, fell in love with cardiology and internal med and that kind of thing. Well, started looking at the research, and I started asking my surgeon that I worked for, I said, hey, can we start checking these guys' testosterone? They're doing all these open heart on, right? Like, I mean, I'd get young guys in there, 40, 50.
Have an open heart surgery?
Have an open heart surgery, right? And no congenital problems or anything like that, or meaning, that they had them when they were born.
I mean, were they like healthy people? Like,
pretty healthy,
okay.
Fairly healthy. Yeah. I mean, there's always those ones that, drug users and those types of things, like, don't do drugs, kids. Guess what? If it goes here, it goes to your heart. Like, that was,
sense.
That was the biggest thing. We'll get into that. But anyway, so I started asking him, like, can we just check their testosterone? Like, I just want to know, every single one of those young guys that had open heart surgery, their testosterone came back below 400.
Okay.
Every single one of them. So then if you look at the research, it's like, well, if we have better testosterone, we can decrease heart disease. If we have better testosterone, we decrease the risk of having prostate cancer. So it was during COVID, and I was like, looking at my surgeon, we just got done. I was like in the thick of school and all the things.
You were like in the mess then.
Oh, in the mess, like in the ICU, trying to help the heart patients. I mean, it was just a mess. But we worked on this guy for, the case lasted 18 hours or something like that. Jeez. We all go home. Well, the on-call was there, and then the surgeon was home. Well, he passed away overnight. And I was just like, you know what? I can't keep watching people die. I can't keep doing this because people were waiting. They were waiting too long to come in and get help because COVID. They were scared to go in the hospital. Yeah. So like our success rates were down the gutter because they were so sick to begin with. Like, and mind you, the people that I worked for, the best of the best. I mean, you had the best chance of surviving if you were to have this procedure with these people. Yeah. Okay. So I looked at my surgeon and said, you know what? I know how to help decrease this risk. And he goes, cool. Bounce. I'll send everybody to you. And if he could have retired right then and there, he probably would have came with me, to tell you the truth. Yeah. And so I started looking more of like, what are the trends that you can start to see before you're on death's doorstep? Yeah. Like, okay, your testosterone's going, like, fun fact, I'm full of these. Men, they start to lose testosterone 1 to 3% per year after 35. Oof. And so if you look at that, you're like, okay, well, if I put it back in there, all of a sudden I've got my muscle, I've got my brain health, I've got my heart health. Yeah. Like, it's not rocket science. No. What changes in our 30s to our 70s? If you're still exercising the same, you're still eating the same, what changes? It's our hormones, So that's what kind of pushed me towards more of the preventative approach and not being a sick care practitioner. I'm not waiting for you to get sick and then, A, B, and C checks out. Here's your prescription. Call it good. No, we're looking in the future. We're seeing your trends and trying to get ahead of things before you go down the hill, Yeah. So that's what made me kind of get into that preventative mindset.
You were sick of doing the sick care and you wanted to just
it hurt my heart. I think for a while I was okay with it because I was like, okay, I'm helping these people. They're not going to lose their husband because I'm here, right? They're not going to go through it because we're here helping. Like, oh, we just brought this person's heartbeat back. Like, there you go, no widow, wonderful, Yeah. And then it just got to the point where I was like starting to connect with these people so much that I'd spend a week with them at a time. Yeah. Like, I was their one consistent person. And then I was just like, oh my God, I can't watch this death anymore. I couldn't do it.
No.
It just got to me too much, where I started worrying about the kids and the family, and then it would tie it to Luke. And I was just like, okay, gotta go.
I'm out.
Gotta go.
Yeah. Okay. How do most people know something's off but don't realize it's their hormones?
So I think the biggest one with that, and I think this is really important to talk about, is mental health changes.
1,000%.
Oh,
I mean,
yeah.
I will openly. How many meds was I on when I came to you?
Yeah. Oh yeah. No, I know.
And I don't care, guys. I'm an open book. If you haven't figured that out by now, like I was on 2 different anxiety meds.
Yep.
I was on a hormone, not a hormone, a antidepressant.
Mm-hmm.
I was on something else too. And I remember something was off because I was on a trip in a cab and with girlfriends, and they were like talking, and I was there, but I was not there.
Right.
And I'm like, I didn't sign up to be a zombie, and
No.
I'm a zombie. And I'm here also to say I'm pro medication, guys. I'm
Oh, yeah,
still
there's
on
a
an
time and a
antidepressant.
place.
I'm not
Yeah.
telling you to go stop taking your antidepressants.
No,
Like, no. I'm just saying, like, a lot of doctors, I believe, no shame to mine, but I'm like, this is going on. You need this. You
Yeah.
need this. You need
Well,
this. Like,
Yeah, no, I mean, you look at the history of it too. Unfortunately, women have not been studied. They did
No.
all of these things based off of a male,
Mhm.
and I don't care what you say. Like, I love my guys. I love my husband. Men, we need them. Love it. But we are not men. We function completely different than men.
Yeah.
Men have a couple hormones that drive their whole being. Women, we have a few extra parts. Like, we need to be looked at. We need
Yeah.
to be studied. We need to not be,
we are
disregarded.
carrying and delivering a human.
Yeah.
Like, why are we not
literally.
studying that?
Exactly. So unfortunately, like a lot of the times, once women hit 30, anxiety starts and depression starts. Life gets real. We get into adulthood where we have to pay the bills, and we have to keep the family, we have to do
Raising
the laundry,
humans,
all the things. So they go to the doctor, and the doctor's like, oh, you're depressed.
Mhm.
That's what it is. Wait, you don't have sex drive, you're gaining weight. What do? We put an antidepressant in to make you have more weight gain and more loss of libido. You know what I mean? And so, but really where that correlates is we start to lose our progesterone. Progesterone is a childbearing age hormone. And if you think back about the history, when were we having kids back in the day? Young.
Yeah.
16, 17,
Oof.
18, younger,
Yeah.
And so and a lot of our environment's changing, and our internal time clocks are changing, where we start to lose that childbearing hormone really soon.
Yeah.
And so really, progesterone, you can put that back in, and all of a sudden, oh, we're not estrogen dominant. We don't feel crazy. We can sleep. We're not having the hot flashes. Our anxiety's down,
Yeah.
So, but most people don't realize that, like, high cortisol and high stress really kills off your natural hormones.
Mhm.
And so if they've especially been through something traumatic,
Yep.
if they've been even competitive sports their whole life, that can really wear on your body. So if you look at it, that's when they're started on antidepressants, is they're like, oh, I don't have the motivation that I used to.
Yeah.
Oh, I'm not sleeping good, or I'm sleeping too much. I must be depressed. And it's like, oh, so that's one of the biggest things that people need to realize. Like, yes, time and a place for modern medicine. Absolutely. Like you said, like, I am not telling anybody to stop their antidepressants or anti-anxiety medications, but just have somebody dig a little deeper. It might not just be because you're depressed. You know what I mean? It's probably a disbalance.
I did an event at her first clinic, and people were doing stuff, and I was like, try my blood. Like, let's see. This is how my hormone journey again started, because I initially did it after competing, and then I just kind of, and then I've always been someone who has worked out regularly, like weighed every ounce of food, macros counted. Like I was almost borderline, like obsessed. Like I always kind of felt like I was like fighting this battle to be where I felt good.
Yeah.
And you're like, let's just take your thing. And I remember coming to the follow-up appointment, and you're like, how are you functioning?
Oh, yeah. Yeah.
And this isn't a HIPAA violation, guys, because it's about me. And so I'm going to talk about it. I am the patient. So we are going to open my book, and we're going to talk about it. Like, literally, you're like, I think you told me I was like post-menopausal. And I was like, I don't know. I thought this was just 30. What was it? 35? I thought this was normal.
Well, and that's the problem, is a lot of people don't realize that you can be. I mean, I found a 33-year-old in full-blown menopause. Full-blown menopause, meaning no estrogen, no progesterone, no testosterone, not making any hormones. And so, yeah, like I feel like women especially, It's mom syndrome is what I call
Oh,
it.
yeah.
We just push through.
Yeah.
It must be normal. It's something that I got to deal with. I'm just going to do it.
Yep.
And we always put ourselves on the back burners, but we can be so much better for our family if you're healthy, right? And it's not your fault. It's not your fault that you've lost these hormones. And I mean, competitive, bodybuilding and things like that definitely drain your hormones. And everybody in that world knows that. Like, they definitely do. But it's about putting them back in a safe way. So not only do you feel good, but you're also not going to, increase your risk of breast cancer. You're not going to increase your risk of Alzheimer's. Like, let's talk about the long-term effects of not having hormones. And so, it's really important. I do remember that day.
Yeah. And the things that are wild too is like genetic stuff that shows up too. And
absolutely.
And I don't care. This is controversial, so we're going to get into it. We're going to talk about GLP-1s.
Oh, yeah. Mm-hmm.
Because, everyone's like, oh, it's cheating. I'm here to tell you, I think I was your first.
You were one of, you were my second, actually, of my whole practice. You were my second one, and I had absolutely no idea what I was doing with it. Now I do, absolutely. Like, I know it inside and out. But
I know the whole internet just went, Cassidy Bybee was on a GLP. Yeah, bitches, I was. And guess what? I lost 40 pounds.
Yeah.
And people are like, you didn't have 40 pounds to lose. You know what I gained? Peace of mind.
Oh, yeah.
Because my body reacts to insulin differently.
Right.
And I could literally weigh out every ounce of pasta and wasn't budging.
Oh, yeah.
And I was working my ass off.
Yeah.
And now my food noise is gone.
Right.
And now I have a healthy relationship with food, because I don't care who you are, unless you're like one of those bitches. Not that you're bitches, we all love you. But unless you're like one of those girls that's just like, oh my gosh, I'm going to eat a cheeseburger and I'm a size 2 and I got an 8-pack. Like,
right.
I wasn't one of those girls. But now it's like, I don't even think about the things. Like, I used to go out to eat and be like, oh my gosh, I got to do an extra 40 minutes cardio tomorrow. Like,
right.
It's just shut that off.
It's time consuming, and it literally can start to feed, unhealthy habits and eating disorders and those types of things, because women are so worried about that. Now, when the food noise, which I love to talk about this with my patients, the food noise is your body's way of telling you that something is not right.
Yeah.
You are not a stress eater. You have high stress because your body is under stress and asking you for the appropriate nourishment. Okay. Now, the fastest way that our body gets that feel good, that quick energy, carbs and sugar. That's why sugar. Yes. That's why we crave the carbs and sugar. So when GLP-1 RAs came into the picture, I think that they were phenomenal. I think a lot of people jumped on that train because they were excited about what it did. But unfortunately, a lot of us providers didn't know how to prescribe it appropriately, right? And so that's when all the side effects came.
Yeah.
If you don't eat for 4 months at a time, you're going to have issues. That's just how it is, right? But if you do it the right way, where you watch your patients and you require a minimum intake of this, you microdose, that is the main like game state of this whole thing. Microdosing those medications is, like I said before, the fountain of youth. It decreases your inflammation.
Yes.
It decreases your cortisol. It decreases visceral fat. Visceral fat is what's going to kill us. It's insulin resistance that's going to kill us later on in life. So microdosing these medications, meaning that you still have an appetite. You still eat, right?
Oh, I will still pound a
right?
freaking double from In-N-Out Burger, and I am not getting the lettuce wrap anymore. I'm now getting the bun. So how do I eat my In-N-Out Burger?
Oh my God. She sucks the whole packet of sauce into her mouth and then puts her French fries in there. Yeah.
It's the only way to do it, fat kid style. No judgment.
I mean, it's not messy by any means. Yeah. It's great.
But no, it's also like being self-aware too. And I think it was kind of good on we've talked about it. Like, I got to a point on it. Like, I was like, okay, Haileigh, we got to do something. I'm too skinny.
Oh yeah.
Like, and we did. And then I put 10 pounds on and I've consistently been this like 145, 148. And it's a good, healthy
But you never got to high dosages either. No. That's the thing, is like, you never got to those high, we don't need the high dosages unless you're, 500 pounds, full blown type 2 diabetic, and you need health coaching and a personal trainer and all of the things that way, then sure. But microdosing makes a big difference that way. But what it does is it literally makes your body process that insulin and glucose. It also will make it so we don't overeat. As Americans, we overeat. Like, so much
Yeah.
more than we should. And so it delays gastric emptying. So you do small, frequent meals. And so that way it still, creates that movement in your gut, which is called peristalsis. And you make sure you drink enough water and things that way too. But if you look at the research, like one of the GLP-1s or GLP-1 RAs is literally being studied for regenerating neurons in the brain, like protecting against Alzheimer's. And
Well,
so
I saw something about breast cancer too. Like,
yeah. So
it's
that
like
one,
literally helping people with addictions. Like there's
Yeah.
so much good. And I'm
yeah.
like, the
It's-
world is just so quick to judge.
Oh, yeah.
And I do think people abuse it. Yes.
Oh, yes. Oh,
I
yeah,
do think people
absolutely.
do not have the proper protocol. But I mean, Hailey's like a freaking drill sergeant. She's like, you want skinny shot? All right, you're going to meet with my trainer. You're going to be a nutritionist. You're going to check
Right.
in. You're going to do this because that is the proper way to do it.
Oh, yeah.
Like just getting it online from your homie.
Kind of scary.
QR Med 101 and then
scary.
shooting yourself up. You're going to end up in the ER
Oh,
like
yeah.
barfing yourself. Like that's stupid.
Oh,
but
yeah.
like, so with everything, right? There is a healthy
Healthy
and
way of doing it.
there's
Too much of a
lean
good
too
thing.
much. Like
Yep.
there's some people that I'm like, honey, you need to eat a cheeseburger, get off the GLP-1.
Oh, yeah.
Right.
No,
And I was aware, like I was like, I saw a video of me and I was like, okay, we're looking a little gaunt, Haileigh. I need to grow some ass back. Like let's and I was. And I think that's the difference is I think having and my body just feels and I'm still on it, you guys. I'm on a very minimal micro. I take it like once every 3 weeks, maybe. Like
just enough to keep you sensitive,
Yeah.
cell sensitive. Yeah, absolutely.
But it's like, yeah, it's going to help with my insulin resistance. Yeah, it's going to help with my energy. It's going to help. Like, it's just helped
joint
me.
and body pain and brain
Yes.
function, like all of the things. It's actually really important for perimenopause women too, with those huge fluctuations in our hormones. Like it's just kind of a good added little layer that helps us with those high highs estrogens and those low lows. Just helps us with our joint body pain and that inflammation. It really, it's a game changer, but it can be abused. And I am, like I said, I'm
not
a stickler.
abused at Hailey's clinic.
Oh, no. People have fought me tooth and nail for it, and I will not give it to them if they don't do A, B, and C. Like,
and something I respect about Haileigh is it's like, you don't follow the rules, see you later.
No,
Like-
yeah. I'm not here to, I mean, I love my patients.
Yeah.
I love my patients and I love all people, but I am not going to let you hurt yourself. That is just not in my, that's not why I went into medicine, you know?
Well, and you're going to be under the proper care. And it's not, with Haileigh, it's not about the money. It's not about, all right, let's fling, 70 vials of it. No, we're going to make sure we're giving these to the people that need it. They have the right structure. They have the right,
Yeah. Oh, yeah. And my girls are the same way that all the girls that work for me. Like, there is a very tight guideline.
Oh, yeah.
And if the patients don't meet that,
sorry.
Snooze, you lose, dude. Show me you can do better, then you can get your med, That's just how it is. And I've made a lot of people mad that way, but that's okay.
Yeah,
You'll love me for the long run.
The world knows I was a cheater. Not really. I was smart and I feel better. Okay. So Jack Wagons, you should probably call Haileigh. Okay, thanks.
Well, one of these times we need to talk about why it was hard with Joby, why it was hard for you to get pregnant, why, how polycystic ovarian syndrome played into that.
Yeah.
A lot of people that's overlooked, and that's why the GLP was so important for you.
Yeah.
That's the basis to that medical condition,
Totally.
So yeah, that's a whole other podcast.
We could talk forever. Okay, so we're going to talk a little bit about intimacy and libido.
Yes, absolutely.
Okay, so how often is low libido actually hormone related?
Well, 90% of the time, to tell you the truth. It really is. I mean, sometimes it's the biggest thing too that you guys talk about a lot is that lack of connection and communication. That I would say that and hormones are the main problem there. Like I said, with testosterone loss in men, testosterone is what drives a man. It is literally how they think, eat, sleep, function, perform.
I know at this point, I'm like, do not take an extra click, Joshua.
Josh doesn't get any more testosterone.
We do not need any more testosterone in that man.
Well, men are so easy. Men are so easy to get feeling better. Like I said, women have a few extra parts. But after we have babies, or just as we age, testosterone is what's used to repair and regrow muscle tissue. It is our natural anti-inflammatory agent. So these little mommies, that have had 4 or 5 kids, their testosterone is depleted because every time that testosterone is what brings everything nice and tight again, right? What helps our body heal, which is just miraculous. But we usually I hardly ever see a optimal testosterone. Now let's talk about optimal versus normal, right?
Yeah,
Because I think
what is
that's
that?
huge.
Yeah.
So normal means that you come back within this predefined reference range from a lab, okay? And how they get these reference ranges is they take the average population of your age group, mind you, none of them are on hormone replacement therapy, and say, okay, average, this is how it should look. This is where you should be. So, I'm 36, right? The next person that walks through my door could be 36, but maybe she doesn't have a thyroid. Maybe she doesn't have her uterus. Does
That's
the
not
lab
in there.
The lab doesn't
Jerks.
ask one thing. They ask your age and your gender.
And if it's, I think the way that you explained it that made sense to me was like optimal. Like you could be at the bottom of normal, but are you optimal? And I'm like,
Correct.
yeah.
Correct.
So we just feel like garbage.
Right.
And that's
right.
normal.
And I love to
Yeah.
use that example with testosterone. You know, males' testosterone, a normal would be 250 up to 1100. They come back at 252. They're like, oh, nope, lab says you're fine. Everything's great, right? And so, but optimal would be around that 1100. You want to be optimal of that.
You want to feel like freaking Superman.
Yes.
You want to have energy. You want to like.
Yes, exactly.
Yeah.
But I think the main thing is, this guy told me one time, he said, if you listen to your patients long enough, they'll tell you what's wrong with them. They will tell you what they need if you listen to them long enough. And so when we're looking at labs, like, we have to listen to the complaints. We have to listen to the patients. Like, they could tell me their libido is awesome. Their sex drive is amazing. And maybe their testosterone doesn't look optimal. But I'm not going to touch it because they say that everything is great there, right? So this is the importance of being honest with your provider.
Yeah.
I do really like it when my couples come separate from each other.
Yep.
To be honest with me. I do like follow-ups together because it's a big gauge of, hey, how do you feel like they're doing? Oh, she's a completely different person now. Or, oh my gosh, he's no longer mean anymore. He's happy. He's sleeping better. But just that initial consultation of having a true, honest conversation with your provider and not being afraid to say, hey, like, it hurts during intercourse. Or
it's not supposed to hurt.
Or, hey, is this like normal? Like, this happens during that time. Or it smells this way. Things are not talked about, and they should be. You have to be honest with your provider.
That's a really prominent problem here.
Yes.
Because Utah, the LDS culture, they're not educated. Like, I mean, I've shared my fair share of things of, people they just don't know. They're just ignorant and they don't know, and they don't have a safe space to discuss these things. And so finding a provider like Haileigh that's able to navigate those things. I mean, half of these women don't even realize that, like, no, lubricant is a thing. It is an every time thing. Like, this isn't just, and I hate the myth of men are like, oh, she's not into you. You didn't get her wet. No, you freaking dingleberry. Like, that's like a science thing. Like,
that has nothing. Yeah, exactly. And the other thing that's really not talked about is expectations. Like, this is what you can expect with your first time having intercourse. This is what's normal. This is how you make things better. So that's why I think you are so important for these little people, that, like, these young ones, that they don't have to talk to their parents. They don't have to ask an aunt that maybe not tell them. They can literally learn from you, which is so important. So in our practice, we're actually going to start doing like premarital consultations.
Yeah, smart.
Just so they know what's normal and what's not normal. I mean, I had a little gal say, I don't understand how you guys swim with tampons in. That's weird. And I was like, what? What do you mean?
Was she laying it like
they were just laying it in between? I'm like, well, now wait a minute. No,
it goes in.
Yes. And so having a safe space with anybody, like just somebody that they can sit down and talk and ask questions about, I think that's really important. But to answer your previous question.
Sorry, we could ramble.
No, that's okay. That's what happens in our personal life too. That's why Matt will never take me to your house, because he's like, you guys just talk.
We still got to talk about Matt. We will.
Yes,
I love you. We will talk about you.
Yes. But anyway, it's most women are like, well, this is just how it is, and I have to get put on this antidepressant, and it kills off my libido more. Like, testosterone is not just a male hormone. No. Like, testosterone is so important for females.
And you're not going to grow a penis, so chill out.
That's what I always say. I'm like, my testosterone's at 1200. Okay, that is a little bit high for females. Yeah. Like, if you're looking at a reference range. Am I growing hair? No. Am I growing something that I wasn't innately born with?
You're such a bro.
No. I know. Yeah. I'm like, I'm not, my voice isn't this long. You know what I mean? Nothing like that happens. And so that's what leads me back to, like, don't be afraid of hormones. Yeah. Oh my gosh. Like, you need them in all aspects of life, especially with intimacy.
Like, the pain or comfortableness with intimacy,
Oh,
because there's
absolutely.
things that happen if there's a lack
Yeah.
of estrogen or a lack
Oh, yeah.
of progesterone and like all
Mhm.
those. Can we talk? This was not on my question, but can we talk about this? Because this is like a thing.
Yeah.
Okay. What is it with the younger girls nowadays not wanting to touch birth control? And then I get
Yes.
really concerned about it, because especially if they're like on like progesterone, because I'm like, are you going to have quadruplets? Like, what if they're like, why are
Right.
they all so afraid of it?
You
Why is
know-
this a thing?
You know what I would like? So let's clarify that a little bit. So I find, and I agree
It's
with
a
this.
thing.
I agree with this. I find that more people are becoming aware of what oral birth control does to a female body. What
Because
it
I think
does.
there was too many doctors that just put girls on it when they had a shitty period.
Well,
or
especially
shit.
especially for
okay.
PCOS. You know,
Okay.
8 out of 10 women have polycystic ovarian syndrome. Horrible periods,
Crazy
premenstrual
stat.
headaches, all of the acne, everything
Uh-huh.
comes with that, right? So let's just slap a band-aid on it. Let's shut down those hormones with oral birth control. So then you just took a 16-year-old and put her in an 80-year-old body overnight.
Yeah, that's terrible.
So then they have extreme mental health problems
Yeah.
because estrogen and progesterone are what keeps us sane, right?
Yeah.
They have extreme weight problems. Their skin hurts, all of the things.
So that's why these young girls
So
are afraid of it.
So finally now people are figuring out, oh, oral birth control probably isn't the best thing for me. But then there's this whole other taboo thing around IUDs.
I know.
Because back in the day, they used to not be able to place
They wouldn't
IUDs.
let you place it unless you've had a kid.
Correct. But
Okay.
now they make them so little and so
Yeah.
flexible. Anybody can have them, and it's great. It's wonderful. So in a perfect world for me, yes, hormonal IUDs have a small amount of hormones in them.
Yeah.
They are very local to
Yeah.
that uterus, very protective.
Where they need to be.
And then we can have natural progesterone on top of
Uh-huh.
it and feel like $1,000,000 and not get pregnant, right?
Yeah.
But a lot of times people will come in and be like, well, I'm on oral birth control. I can't give them progesterone. If that's how they're not wanting to have a child, like if they don't want to get pregnant right now, I can't give them real progesterone. It'll counteract their oral completely.
Yeah, they'll get
there
knocked
you
up.
go. There's your baby right there.
And we love babies.
And we love
but
babies.
sometimes they're not ready for babies.
When you're not ready, you're not
and I'm
ready.
noticing it with like younger women that I'm
Oh, yeah.
involved, and they're just like, oh no, we just pull out and pray. I was like, pull out.
Oh
and
yeah,
pray.
yeah. The pull out and pray method is not reliable. I cringe every time. I'm like, so what are we doing for birth control? And they're like,
We pull out.
well, we check our cycle. You
We
have
tuck and roll.
Yeah, I'm like, you check your cycle. You have PCOS. You don't know when your cycle's coming or
Oh
going.
my God. They
Like
got the
what are we- like that
ring.
is
I'm
just
like,
plain Russian roulette, my man. Nope, we're getting pregnant. So.
Oh, okay, all right.
But
Good
that's
to
where
know.
that comes from. So a good thing and a bad thing. Good thing is there's other hormones that are available. Bad thing is they're clumping them all together, unfortunately.
Unfortunately.
Yeah.
Okay.
Mm-hmm.
What hormone myth drives you crazy?
What hormone myth? Oh,
I knew you should take that
hormones.
question.
Yes. So that hormones cause cancer. That is a lie. That can I say that into the camera?
Liars.
That is a lie.
Yeah, I said penis and fuck earlier, so I'm pretty sure you can say that is a lie.
That is a lie. So they, like I said, they clump natural hormones in with oral birth control hormones. And oral birth control shuts down our natural hormones, causes us cancer because natural hormones is what protects us from cancers, right?
Okay.
And so, especially estrogen, okay? All of like for the last 22 years, the whole world has been afraid of estrogen therapy because of that poorly designed study, okay?
The horse.
Yes, the pregnant male horse urine.
Nay.
Right? Is that the same as what we produce? Absolutely
No.
freaking not.
Have you
right?
seen horses have sex? It's intense.
Oh, it is intense.
It's like this long.
Well, that's also how they cool themselves off. So they're not just Randy sitting out there in the in the field. Don't you
my
worry.
previous life, I was married into a family that raced horses, and like they would like sell the semen, and I just remember it was.
Oh, yeah.
I was like, where is that going?
No, it's a thing.
Sorry, side
It's a
note.
thing.
Okay.
Side note, but yeah. So now it was really nice. In May of 2024, the people that funded that study issued a public apology for
good for
harming
them.
women for over
Good.
20 years. And then now big thing is the FDA 2 months ago finally said,
Yes.
oh yeah, it doesn't cause cancer. Let's take that off of the box because get this, I would send in a prescription for, like, this isn't one for cancer, but I'd send in a prescription for progesterone for those women that can't carry, right? They keep having miscarriages at 8 or 9 weeks.
Yeah.
So like, okay, here's your progesterone prescription that you need to take when you get pregnant.
And then you need to take it up to week what?
13.
Okay,
Always. Well, they look on the bottle and it says, don't take while
Oh,
pregnant.
jeez.
They were literally clumping progestin, which is in oral birth control to keep you from getting pregnant, with progesterone that increases your chances
Those
of
are two different
carrying.
words.
Exactly.
Okay.
So that's my biggest thing that just drives me nuts is they just extrapolate the two of them and just say, oh, it's all the same. One of them keeps us from getting pregnant. The other one helps us. How is that the same thing? It's not at all. So that's my biggest thing. I can't stand that.
Okay. If a doctor brushes someone off, what should they do?
Unfortunately.
What is Haileigh's phone number?
Yes. What is Haileigh's phone number? Yes. Call us. We've got, we have 4.5 NPs right now. And a half. She's training, so she's doing great. But, unfortunately, in healthcare as it is, whether it be hormones or not, you have to advocate for yourself.
You do.
You have to. It's almost like we've got a standing rule in my family, and you know this. Anybody that knows me close or personally, if they're going to the hospital, guess who's going with them?
Aunt Haileigh.
Me. Oh my gosh, yes. Because it's just so many times, especially with women, unfortunately, like I said before, oh, I just not feel good. I'm having a hard time losing weight. My mind's kind of scatterbrained. Oh, SSRIs. Instead of, oh, well, maybe you're going through perimenopause.
Mm-hmm.
Maybe we should look at your hormones and see what's going on there. So if they're dismissing you and they're not listening to you, I don't care who you see. Go find somebody that'll actually listen to you and spend the time and also know you by name and not chart number. Okay.
Yeah.
Like my girls, it is a thing and they all know this. I want you to know that person by their name when they walk in that door because they are a person. They are here to get feeling better and to get help. They're spending their time with us and trusting us. Like if you're not getting that type of relationship with your provider, there are plenty of us out there. Find somebody else,
Well, and you're dealing with probably the most intimate part of their lives.
Oh yeah.
With hormones because it's all connected into that.
So we go through puberty twice, Cass. You know that? We go through puberty.
No, I just learned this.
And then we go through cougar puberty.
I should have brought that brings me to the covet this. I think the one we should talk about. Do you know there's nipple clamps on my website and they say cougar?
Oh, do they? Oh my gosh. I love that.
So you can get your nipple clamps.
Yeah.
Because people are into nipple play. Sorry. They literally you clamp them and they say cougar. Yes. Meow.
I mean, they're for everybody else too.
Puma? What's a puma? Is that right before you're a cougar? Have you heard that?
Oh, maybe. Yeah,
I heard cougars. I hear pumas like the pre.
Two things that I'm really not good at.
What
is anything to do with species and geography? So I couldn't tell you
either. I'm not good at that either. I'm not good at math either. Okay. Hold on. All right. I'm not going to ask any more of these dumb questions. One more thing you want to share. Because we're going to have to do 6 more of these because we didn't even talk about her freaking vagina machine and we're going to talk about that.
I know. Ooh, yeah.
We're going to talk about diet soda.
Oh.
Because Josh at the end, she hasn't watched it, but Josh at the end of our episode, literally was like, anybody who watches Haileigh's episode, we're going to give away a 12-pack of Diet Mountain Dew.
Right. I would beat him if he did that. Let me ask you a question. Before GLPs, have you ever met a skinny Diet Coke drinker? When? Who? Besides my stepmom, which she has just got guts of steel. I have never met a skinny Diet Coke drinker.
Our friend Mikkel.
Okay. She's drinking. She's like this big. She's drinking up anyway.
I know. So, she drinks
she drinks like this much. So diet sodas or artificial sweeteners in general, they still do the same thing to your body. Your body still releases the insulin. The insulin has to bind to something to get into the cell to be used up for energy. Well, when we take in anything with artificial sweeteners, say Diet Coke.
I still drink it, guys, but I will listen.
Every time I open your fridge downstairs, I want to murder you guys. I scream for the top of my lungs every single time. No, don't listen to her. Anyway, so every single time what that does is it blocks leptin. Leptin tells you that you're full or satisfied. So that's why most people can drink, a 44-ounce Diet Coke.
Diet Dr. Pepper.
Yikes. Or they can drink a half of an 8-ounce can of real Coke, and the body's like, "Hey, you're done.
So
you're
thick and sugary to me. It's like I'm drinking syrup. It's like I'm the guy on Elf, and I'm just pouring syrup in my mouth.
But at least you won't overdo it, right?
Well,
but then what happens is after you drink that, you've got so much of this little molecule floating around in your system, being like, what the hell? Where's the sugar at? I was released for the sugar. Where do I find it?
Oh, yeah,
so then it tells you, I need sugar or carbs. I need sugar or carbs. You're starving me. And you know when your phone goes down to that little red line, the battery line, right? And it kind of dims. That's what your whole body does. just like dims out because it
Can you do
has
that again? That was
no
so
energy. Because it has no energy because you're totally tricking it with artificial sweeteners. And so like truly the best thing for you, like stay away from artificial sweeteners. Like they're in everything. Don't get me wrong. They're in everything. So I'm not telling you to go and buy like organic ketchup or whatever the hell people are doing nowadays. Like it's fine. Just don't do diet drinks. Don't add diet stuff into your daily regimen. Like truly.
We'll discuss this at a later point because I am somebody who craves the diet flavor. Love you.
Most of the time it's because you're not eating enough protein, my dear.
Probably. But I do try to do protein first. That is something with GLP-1s. Everything I eat, I try and grab
You
the
have to
protein.
get protein.
You have to get your protein.
You have to.
You have to.
Well, it's fueled by it. Like you can literally fuel those medications with protein.
Yeah. So I'm always throwing down the protein. Okay, I want to talk about Matt because I don't want Matt to be like, you didn't talk about Matt. We love you.
He doesn't
we love
care.
you, Matt. The funny story
gosh.
about Matt is this one was like, I'm done with men. Do not let me date any other.
Okay, I made some really poor decisions. I dated
We all
people
do.
way out of my bracket.
We all
Oh
do.
my
But she was like, snap me out of it. Do not let me like fall. Like, so 4th of July, I have like this barbecue and she like comes and I was with her 2 weeks prior, like 2 weeks.
Well, you're the reason why I met Matt because you told me to So we were in Orlando and you told me to download.
Not a place to go on a girls trip if you want to go out.
Oh
Just
my
saying,
God, no,
Mickey
don't.
Mouse ain't going out.
No, don't do it. Don't do it. Anyway, we downloaded Bumble so we could meet
Haileigh
people.
downloaded Bumble.
Haileigh was single. Haileigh downloaded Bumble.
Not me.
So we could
Calm
meet
down.
somebody to tell us
Where to
go.
go. There
'Cause
was
there's
nowhere to go.
Oh my gosh, it was awful. They were either way too young or way too old. It was awful. Well, anyway, it didn't work out anyway because I didn't ever like.
We went
meet
to one
anybody.
place and had tacos and then found out it was like some creepy like
Oh, it was so
child
bad.
creeper.
Oh, yeah.
We're like, get us out of here now. It
Yeah,
was bad.
then
not
we
safe.
just stayed on the
were
resort the rest of the time,
We
yeah.
were safer watching Love Is Blind and
Yep.
eating peach
Yep,
cobbler.
on our resort. You know, it was great. Well, I didn't eat any peach cobbler.
Anyways.
Cassidy ate it.
Anyways.
Anyway, so we get home on the airplane, and you didn't fly with us because you went to Miami. But we got home on the airplane, and I opened the app to get rid of it because I was not, like I told you, I was done dating.
Done dating.
I was not doing
She's
it.
like, F those mofos.
Yeah, I was like, nope, not good. Well, by the grace of
I even gave you a toy.
whoever-
Do you remember that?
Oh yeah.
I was like, no more men.
Yeah, you're like, no more men. Here you go.
Sorry.
Congratulations. So anyway, I opened up the Bumble and Matt's face popped up on it, and he's so
Matty
damn cute.
Matt.
Oh my gosh, he was so cute. I
Was
was
he
like,
in his uniform?
no. So I didn't even know he was law
That would've been a
enforcement.
good move.
Yeah, I didn't even know he was like law enforcement until we had matched already. So, but Tara, our girlfriend Tara, was with us, and I was like, hey, if he doesn't swipe back on me, within the next hour, I'm deleting this. I'm done. I'm not doing this. Right.
He was like, oh, I'm tapping that.
Oh
ass.
yeah, he was like, yep. So anyway, we started, and so we immediately started texting, and the rest is history. Our first date was, so that was on June 27th. Our first date was on June 29th. I took him to the George Strait concert because by luck, the person I was supposed to be going with bailed on me, and so I was like, hey, do you want to go to a concert?
Love that.
By this time, I knew he was law enforcement, though, right?
Yeah,
so I
you'd
felt
been
safe.
talking,
Yeah,
yeah.
and I was like, okay, public place, like it's
They talked for
huge.
3 whole days. Guys.
Yeah, we talked for 3 whole days. I did vet him. I did know that he was a legit law enforcement officer.
And Hailey's
so.
a vetter.
Oh,
like
yeah.
she will scrub the internet and she will find out your cousin's sister's brother's aunt and she will cut a bitch if you fuck with somebody.
I gotta know because if I was gonna go out on that branch again, I had to know that he was normal.
It's true.
Oh, so anyway, so then fast forward. So we did our date. It was amazing. Like he was just everything I've ever wanted. Like, and I just felt so safe with him just immediately.
And then she bebops to my house.
Yeah.
And was like, I'm in love. I'm like, get out.
Well, I told our friend too. I was like, no, I'm gonna marry him. I told Megan. I was like, I'm gonna marry him.
Get out.
And all the girls are like, Haileigh, like,
well,
you
because
just
we
went
were
through
protective
this.
too. I think it's a different. You and I have talked about this. It's a different dynamic too when you're a successful alpha female.
Oh yeah.
And like protecting something you've built and also being protective of Haileigh because of what she's been through and being protective of Lucas. Like we can't just let any dude just come in.
Oh yeah.
Like we gotta.
Well, and I proved that I was not okay choosing for myself.
No,
like,
her, but it was not good.
God.
Yeah.
Anyway, so so I told you guys that at the 4th of July party, and then we were engaged in October. So yeah, we got engaged in October. We found a house. We actually found a house in August. Closed on the house in November, And then we actually just got married this last summer
Yep.
on 6/29, so our 1-year anniversary. And that wedding was so emotional. It was
Matt did so good.
He's just
Like,
so amazing.
I will never forget the line he said about Tyson.
Mm-hmm.
Like,
Yeah.
and I will forever respect the man that
brought him life. And
it was so good.
And that's the thing is he's not intimidated.
No.
He's not intimidated by me. He's not intimidated by Tyson. He loves Lucas. Like,
which you got to have a man like that in a dynamic, like, power play that you and I have. We're very successful. Like, we do not have time for men that are intimidated by what we've built, who we are. And Matt just does it with grace in a way that it's like not, because you know some people kind of like it could be like almost like cringy, like overdo it, but Matt's just so good, and he just does it and just gives it space in such a way. And I actually love Matt because he can boss this bitch around.
He's the only him and my father. Him and my father.
No one. And Matt came in and was like, "Oh, let me show you." You know what I mean? Like, Like Matt says no, and Haileigh's like, "Yes, sir." Okay.
Oh yeah, absolutely. Well, he's earned that. He's earned that respect.
Well, he's not a dick either, so don't take that way. He's just he's very in his masculine.
Oh yeah,
which is needed for someone like you, because
we can be
and
feminine.
I do that too. Like I definitely carry myself in my masculine, right? Like because I'm like this boss babe bitch, and I'm like and so Matt just gives you your femininity. Is that a femininity back? And
you can be feminine because they're so masculine.
Yeah.
But in every other relationship, I felt like I was the dude. I had to do it all. I had to hold down the fort. Like for the first time since I lost Tyson, I feel like the real Haileigh's coming back. Like not the hard, like I just kind of got this hard exterior shell there for a while where I wasn't laughing. I wasn't, having fun. I wasn't going out with my girls. I wasn't enjoying life. The minute Matt came into my life, I was like, my pause button, push play. You know what I mean? Like, because it was just like paused for years and years and years and years. And I just kept building us up, making sure Luke and I had a good life. And like, I just focused on him so much. And then, as soon as Matt came in, it was like, oh, this is what I was waiting for. Okay. This is why, this is why nothing else worked out. And I actually told him that last night. I was like, you're the reason why things never worked out for me, and I'm very thankful for him. So, and he doesn't care that he's not intimidated to have me here with you. He just loves me for me, and he knows he can handle anything.
He didn't love that I took you away for like 5 days for a bachelor party.
No.
He definitely loves Haileigh.
I think that's like it was very interesting.
Like he's supportive of it, but he like misses her. I'm like, that's cute. Josh is like, no, Josh cares. I'm kidding.
Josh cares. No, it was just more of like, he didn't like that nobody was watching over us. And I was like,
he's like,
I have Cassidy and Candace. Like, let's talk about we don't need anybody but Candace.
But Matt is very, and it's just because of what he does. Like he's just he's always observing. He always knows what's going on. He's always like,
he sees things before anybody else does. And that's what I love about him. He's my little protector. Like I can finally just be a freaking goofball, a normal 36-year-old female, like just wants to have fun, and I can finally let my guard down because of him. And that's something. And it's so funny because he's like, I know why you love me so much. And it was like our second date. And I was like, I don't love you. I did. I totally did, though. I knew I did. He's so much like my dad. He's so safe for me because him and my dad think alike. They've always been this very strong, like, demeanor in my life. And, like, he's just so much like my father, not in a non-creepy way, obviously, but he just has the best attributes. And so it's like, oh, okay, I keep you. And I'm going to.
He's fun too.
He is fun.
We just kind of like threw him in the mix of our friend group. Like, good luck, bro. Like, but he thrived.
Yeah, he did.
Yeah, we had fun in Mexico. Like, he's solid. We love Matt. And Jovi, my daughter's safe with Matt.
Mm-hmm.
She feels very comfortable with Matt. I mean, Haileigh saved the day. We had this anniversary trip planned. Something happened, and I was like, I don't know what I'm gonna do. She's like, bring her with us. And Jovi loves Matt. Jovi loves Haileigh. Like, it's just a safe place.
Yeah.
And you've grown a little family now because Matt had 2, so now you have 3, and it's been really fun to watch.
Family, we just have this family unit. I mean, talk about Luke when we walked down the aisle. After Luke bawled his eyes out, and I'm like, "Why are you crying, honey? Why are you crying?" He's like, "I finally have a dad, dude." Oh my God, we were all in tears then. Yeah, it's been perfect. It's worked out the way that it should. And like everybody's like, "Oh, nothing's perfect." No, really, like. It's pretty perfect.
They'll have moments. They just haven't had it yet.
We're in
They're
our
still
honeymoon.
in their
Yeah,
honeymoon
we've only been together a year and a
phase.
half. So yeah.
Yeah.
I'm sure it'll come. But yeah, he's everything we ever wanted. I'm pretty sure Tyson handpicked that one.
Yeah.
For sure.
Tyson's like,
here
you're
you
not
go.
making the right decision, so let me
just send this one in there.
Thanks.
So
Yeah, not that guy. No.
No.
Yeah,
Yep.
there you go.
Yep.
All right. Well, I normally do like questions in the DMs, but I knew that we would just have so much nitty gritty. And I'm going to have Haileigh come back again. This isn't going to be her first thing because I feel like we need to talk about the freaking awesome vagina machine. And Haileigh does, when I say she is my one-stop shop, like literally, she is keeping me and my husband alive. She does my hormones. She does my GLP-1 dynamic. She does my nutrition dynamic. She does my Botox that I freaking burn through so fast, which is freaking annoying, but it's just my metabolism. She does my filler. She does my laser. She does, well, I mean, she did my vagina, the vagina machine. It's badass, you guys. You go from like a weird looking, I don't care. Okay. So I'm going to share it. So the poor cameraman is like, what is happening? Anyway, so like, when I had Jovi, like one side didn't heal. Mm-hmm. And I had like, you know, your outer, you have your inner. I had like 2 pieces on one side. And then it made it uncomfortable. And this like machine just like shrunk everything
talking about
up.
Labial tearing.
Yeah. Sorry guys. I'm not a medical professional. I just called it a floppy vag, but you know, whatever. So, but it literally made a difference. Like it's crazy. Like it's like, oh my gosh, I went from, and something I love to say and teach women especially, like, you are not broken. Your vagina doesn't look funky. Your vagina is not weird. Everyone's a little different.
Oh, yeah.
There's like this art thing. I don't remember where it was, but it's like this wall of vaginas. Have you ever seen that? Where they're all different. Because I think we're going to lean back into it. I talked about it in multiple episodes before. Like my industry is very like porn centric, very porn driven. And it's creating an expectation that's unrealistic. Like, like, it's, and the other thing, do not go and get in, I'm going to say this word wrong.
Labioplasty.
Yeah, evasive. Is that
invasive.
Invasive surgery, because a lot of these doctors are not doing it. I am educated on this. They're not doing it properly. You have to do an ultrasound before you cut anything, because there's nerve endings there that are connected to the clitoris.
Well,
okay,
and
if you cut that and then your bean's broken, your life is forever done.
Your bean's
like there is no, but that happens. They're not doing the proper like, and they're just trimming them up to look like a shiny porn star, and like they break their bean. What do you do?
Oh no, I get it.
I guess it's just cougar nipple clamps forever. Like I mean. But seriously, we will get deeper into that because we could go on forever, and I already feel like this has been longer than we planned. No, it's great. So everybody, Haileigh, where do they find you?
So my clinic is on Instagram and Facebook and TikTok. It's Mason Aesthetics and Wellness. So Mason Aesthetics with an A. I'm telling you, I don't know why I did that to myself. But
is that not how you spell it?
No, it's how you spell it. It's just really hard to spell it correctly.
AESTHETIC?
ASETHETIC.
Just Google Haileigh Mason.
Yeah, just Google Haileigh Mason.
But her name, go ahead and spell your name out.
Oh yeah, my name is Haileigh, HAILEIGH Mason.
Typical Utah parents, you know.
That
they're
was
like,
even, my parents weren't even Utah.
I know. Let's add an IGH.
They just like to make things difficult. It's the old English way of spelling Lee. It's the real way. So just,
you're the only one I know that has it spelled that way.
Well, I'm the only correct one.
Yeah.
Anyway, but we're located in West Haven. We do telehealth appointments all over the place. But yeah, we're everywhere.
Yeah. So if you're not in Utah and you're listening to this podcast and you're like, man, because I know a lot of you mofos DM me and you're like, oh my gosh, my lady needs her hormone shakes, or I need I send you to her because it's like. And when I say her, just understand, she's got like a mecca of an office. So even if you don't get her, you're getting her.
Yeah, I'm too much of a control freak.
All these practitioners are just like Haileigh, and they're great because she's such a badass. This shit just blew up so quickly, and everybody just started feeling so awesome. And
and they're trained just like me. I'm too much of a control freak to not let it be just like me. So,
So even if you live in Milwaukee, give Haileigh a ring on the bling bling.
Yeah, absolutely.
All right, guys. And next episode is just going to be me. But thanks for joining the Law of Cassidy. Let's talk soon.